Thank you very much. Let me ask you, we are certainly aware of many people who live near drilling and who have medical conditions that have developed since drilling began where they are, and who certainly believe that their medical conditions are attributable to or a result of the drilling. On the other side, the drillers will say, well, there's no evidence of this. They may have a medical condition, maybe they do, maybe they don't, but who knows where it comes from. Is it possible, in your view, either now or with the proper studies, to be able to separate out and identify that yes, this person has a medical condition and that medical condition is attributable to some aspect of drilling? And what kind of studies do we need to be undertaking to help us make determinations like that?
This question is one that is occupying the minds of a variety of public health experts and epidemiologists at the moment. Madeline Finkel, who is the co-author of the article which I mentioned, Roxana Witter, who works in the University of Colorado School of Public Health, and various others are all talking together about putting a conference together in the next 6 or 9 months to address this very issue. What are the best study designs we can use, given a large range of types of studies that are available in epidemiology to answer these questions well? I've spoken to the NIEHS, which is the environmental branch of the NIH, and they strongly support that we should put together a conference of interested parties to discuss how to design properly studies to answer these very specific questions. They think that this is an area they would very much like to fund in the future in terms of research studies, but they think that we need to put our right foot forward. If we design the studies incorrectly, we will get either erroneous answers or no answers at all. And there'll be the problem of having put large amounts of money in the wrong direction. So the answer is that the science of epidemiology does have the tools. Each area to which this series of techniques are applied has its own unique characteristics. Each database you use has its own problems. So I do believe that these are answerable questions. As a physician and a scientist, I think that that's the job of what we do. We have to create answerable questions, and we need to be able to address this. Now, some of the health effects which we've discussed and which have been, which arise from surveys, we can enumerate a list of what are the potential problems. Having said that, as you say, it's very difficult to establish if that is above the background. So we have to design studies to tease that out. In addition, many people smoke cigarettes, for example, and many of the toxins in cigarettes are also found in some of the polluted air and polluted water. So one has to design studies so that you can tease these effects apart, and they've got to be large enough and powered enough to be able to make meaningful epidemiological inferences. And that cannot be done unless you have a large research program. This is something which cannot be done by a sort of mom and pop approach of individual universities, which is why I have been helping or facilitating groups of epidemiologists with an interest in this and biostatisticians and other individuals to look at this as a group so that we can actually propose the scale of studies which will actually address this question.
You talk about the use of chemical identifiers in fracking fluids. How would that work, and what information would that provide that would be useful?
I'm not quite clear about what you're asking here. The
Chemical Abstract Services Registry numbers?
The truth of the matter is that when we were concerned about smoking and its dangers of health, we were dealing with cigarette smoke, which is a mixture of hundreds, if not thousands, of substances. We were able to find links using epidemiological studies between smoking, lung cancer, and a dozen different illnesses, including bladder cancer, as it happens, without necessarily studying each of these chemicals on their own. Hydraulic fracturing is like a bunch of different brands of cigarettes in a way, each of which has each shale has its own signature as to what's going to be found in the produced waters. But I do think that one can study this in aggregate. Where this falls down is really in asking specific hypotheses as to, well, if we left this out of the mix, would it be safer? And without the industry supplying us candidly with the unique identifiers of these chemicals so that we actually know what they're putting in, there's no way we can go back to the lab and say, well, is this an endocrine disruptor? What happens if this is used in experimental animals? Does it have any effect? Does it cause cancer? Whatever. We can't do those sorts of biological plausibility studies, which are not really epidemiological studies. Those are more basic science studies, but they do need to happen, as I discussed in the component of my talk, which addresses endocrine disruption. Because these are effects which can occur decades later. And I see today in my patients, for example, patients whose mothers took diethylstilbestrol when they were pregnant. I still see their daughters and sons today who are coming to me with the problems to their health. So we're talking about things which are not only things that affect people immediately, but they affect the next generation, and some of them may even be transgenerational.
Thank you.
Couple of questions. One, the question I directed to the previous witness as well. Is there a difference in substance or degree between the concerns you would have about the, I don't know, conventional long-standing practice of vertical drilling with hydraulic fracturing versus the new practice of long horizontal drilling? Is it a difference is it a qualitative difference or a difference of degree or not a difference?
Well, I first have to state that I'm not an engineer, so I don't know all of the differences between the two processes, but I do know, as the previous speaker said, that a different tool bag of chemicals are being used, and the scale certainly is very much larger. In addition, the potential for contamination of the environment is greater because the horizontal legs are so very much longer. So I think that probably the answer is all of the above. Mm-hmm. But as I say, I'm not an expert on the subject.
Your observation about hydraulic fracturing, essentially withdrawing a large volume of fresh water from the ecological system and burying it deep underground. Can you give us a sense of the scale involved annually? I mean, if there were widespread hydraulic fracturing in New York State, annually, would that be the amount of water consumed by a small village or half of Brooklyn or
Well,
Texas?
I can tell you, I try to put a scale on it within my own town, the city of Ithaca. For a single hydraulic fracture of one of those horizontal legs, it's the equivalent of the use of the whole city of Ithaca for one day. That's how much is used for one of them. Remember, there are multiple legs. And
one of those for how?
Yes, one of those would be about 3 to 5 million gallons, which is about the consumption of water of a small
For what period of time?
City.
I mean, the one well that you're referring to, is over what period of time?
Just a single fracking episode. It requires an enormous amount of water, from what I understand. And having said that, I think that in aggregate, one of the things about New York State is that our most valuable resource, natural resource, is actually water. It's not natural gas. And if you look around the world at the moment, I think a lot of people realize that. And I worry greatly about what we may do to this very, very precious resource that we cannot renew once it is damaged.
The endocrine disruption process that you referred to. Why? I mean, I can easily understand why very small concentrations of a chemical would cause major disruption. Small causes can produce large effects. Does anyone know why larger concentrations do not produce larger effects? Is it, and do larger concentrations produce a smaller effect?
Well, the endocrine system is very complex, and the way in which the specific proteins called receptors work, and it is such that in some cases when you add more of a stimulator or a blocker even to the receptor, it actually down-regulates, it switches that receptor off. And it does so by a number of mechanisms, one of which can be the receptors are simply recycled back into the cell. It switches them off, and we use that. I mean, patients, for example, with prostate cancer, who need to have no androgens, testosterone, in their system, we give them a huge dose of a hormone called Lupron, which in small doses would stimulate the production of the hormones that lead to testosterone production. But when you give them a large amount, it switches it off altogether. So we actually are using this very property of endocrine disruptors in our clinical practice.
Thank you. And what is the Endocrine Disruption Exchange?
This is an organization which was founded by Theo Coburn, who is an environmental scientist, which has created databases of endocrine disruptors which are characterized in general, but specifically because she lives in a county close to a lot of hydraulic fracturing, to the chemicals involved in this process. It's a non-profit organization, and they at the moment have in press their first publication looking at the range of chemicals which they've identified from material safety data sheets. This shows, and it's really quite compelling data. They started off with 944 products named like OptiClean or whatever you call it, identified 632 chemicals and found the unique identities of 353. And when they looked in the literature, ToxNet, PubMed, and other places, 37% of these chemicals were shown to have some reference in the literature to an endocrine property. Now, that does not mean that these are all endocrine disruptors, maybe only a small portion. But what it raises is the concern that we haven't got yet a decent set of assays by which to identify which of these chemicals actually are endocrine disruptors. The EPA has now set up a protocol for this very purpose, but it's not a swift process, and it's not a cheap process. But I do think that here we have a finite number of chemicals. Of course, we don't know the identities of many of them, which one could put through these types of assays and at least rule out those which appear to be bad offenders. And I think we have the technology to do this right now. And I think that this is a project that needs to happen.
Thank you.
Thank you for your wonderful testimony, Dr. Law. We've heard from two top-flight scientists right at the top of this hearing, and I want to congratulate the two chairs for bringing you to be able to share this information with us all. I am very concerned about many of the parts of your testimony. Let me just first say, though, that you've helped frame in concept a couple of important things. One is particularly poignant, in which you indicate that hydraulic fracturing appears to be a large misconceived experiment in which unspecified toxins are being introduced in an unpredictable fashion to human subjects without any systematic or scientific attempt to establish or quantify its impacts on human health and well-being. That framing of concept, I think, is very important. So even if that was the only thing you said when you came here, I think that was a meaningful contribution. But you said much more than that. The Energy Policy Act of 2005, you said that researchers, as a consequence of the limitations placed on information and data gathering, this is to quote you, researchers and policymakers are forced to play a guessing game to identify chemicals from the material safety data sheets the gas drillers are mandated to produce. Unfortunately, the MSDSs contain proprietary names, and although we can be fairly certain of the identities of many chemicals of this kind, of time-wasting analysis, we cannot infer unique chemical identities of many others. This 2005 then, this is my words, this appears to me to be an intentional blinding action on the part of policymakers in 2005 so that we would not be able to have scientists really have a chance to look at things accurately. That's most unfortunate, as you've pointed out. What do you think we should do as policymakers and lawmakers to attempt to open the eyes and restore the sight and clear vision of what we're dealing with? What policy changes need to happen to enable scientists to do what they're supposed to do for our society?
Well, I think that this is a self-defeating business strategy by the energy industry, which is a hostage to fortune for them. I think that they've tried in many different ways to wriggle around this issue, and in some senses have been a bit disingenuous. For example, Halliburton put up a site or a website about what fluids, what are found in fracking fluids in Pennsylvania and some other states. At the very bottom of the list, there's a chemical which is called water, and they give it the Chemical Abstract Services number. But of course, they're highly selective, and they have not been cooperative with the EPA in answering a subpoena to divulge what they're actually adding to the fluids. Other energy companies have come together, and they say about 80% of them have to disclose what the chemicals are, but they've reserved the right to exclude those which give them a proprietary advantage. So we know from the track record at this point that there's not going to be a voluntary submission of this data. And therefore, this has to become the absolute prerequisite to considering the introduction of hydraulic fracturing to any new area or anywhere for that matter. Unfortunately, as far as I understand it, the federal government do not look like they're rapidly going to do this. I know that there are a number of acts which are going through Congress at the moment to try and at least restore these provisions to the Safe Drinking Water Act, which is what took them away. And I think that that's probably the best route. But I think that each state has the right to say, sorry, we don't want your technology here if you're not going to be candid with us.
Well said. Simple question. Shouldn't industry pay for some of the costs of this research?
Absolutely. And in fact, in various versions of the precautionary principle, it suggests that those people who are going to profit from these technologies should contribute to the understanding of the possible pitfalls. And of course, this should be done in a open-handed fashion. I think it would not be good for them to do what you might call advocacy-based science, where they say, well, we've got our team of scientists and we've given them a lot of money, and look, this is very safe. I'll even drink the water coming from this. I think that kind of approach will not work. I think that this needs to be money which is given to independent bodies which can then distribute it to reputable scientists who have applied with peer-reviewed grant submissions.
Bad theater is not what we need. Good science is what we need.
Exactly.
Thank you for your good testimony.
Thank you, Dr. Law, for your testimony. I just wanted to make 3 comments, not necessarily questions, but if you can call a question, by all means answer it. I find as a state policymaker, your testimony particularly compelling for its irony, and a positive irony. Number one, one of the things is the transparency aspect of it. As someone who is a state lawmaker who is constantly scrutinized for transparency in the way we do government, and we're constantly in terms of the press, in terms of our public opinion, that transparency aspect, which is so important to what we do, that irony that comes out, you know, from the industry perspective is very compelling. Also, I want to cite what the chairman, Chairman Sweeney, talks about, finding the causal linkage. I mean, I think that's the excuse that's given, that we cannot find the definitive causal linkage in terms of the technology to the medical health implications, which I find you can never definitively, in other aspects of policy, can you ever really definitively find out. That is the great mystery of life. You cannot. But there is the assurance that based on common knowledge and science that we can find that causal linkage. And I think that's very important of what you said. But the most important thing to me, and the line that you have in here, which really stands out as a policymaker, is one of the things that I look at, and I'm trying to be fair-minded, and I look forward to hearing the testimony from the industry, is, you know, why are we doing this? And as a policymaker, it's national security concerns, freeing ourselves from foreign oil dependence, which is certainly very much a hallmark of what I stand for. But you bring up a very interesting point, which has not been, I haven't heard before about, in a drought-afflicted world. In terms of national security, it's not just oil and gas, it's also water. And we're starting to see that particularly in Africa, particularly in China, particularly in Israel and the Middle East, and that so goes the neighborhood. In other words, we are a global economy, we are who we are, and our security concerns will, I believe, someday rest more with water than it does with oil and gas.
New York State is the Saudi Arabia of water.
Thank you. So as a policymaker, one of the concerns that I have is, and you should point out, help people, but also you must not do harm. But does our policy, the ends, I hope, always justify the means? And it has not been, that's what I'm hoping to get today and going forward. Does the ends, which is freeing ourselves from dependency and allowing the consumption to continue in security, does it justify the means? Are we setting ourselves up for more policy concerns that we will have to once again address decades to come? And that's the irony of what your statement brought to me. And I thank you for that, to bring it to the public domain. Thank you. Is that a question?
Thank you very much, Doctor.